Have you ever noticed foam swirling in your urine and thought nothing of it? What if I told you that little foam could be one of the earliest red flags that your kidneys are under attack? Most people believe kidney failure only comes from obvious bad habits like smoking, drinking, or ignoring their health. But here's the twist. Even people who seem perfectly healthy, eating well, exercising, doing everything right, can still quietly damage their kidneys without knowing it. Let me share a story. Maria, just 42 years old, was a marathon runner, full of energy, and considered herself the picture of health. She thought the foam in her toilet bowl was from cleaning products, but it was her kidneys crying for help. By the time her doctor checked, her kidney function had already dropped by 30%.
And here's the scary part. According to the National Kidney Foundation, you can lose up to 90% of your kidney function before noticing any symptoms. By the time fatigue, swelling in the legs, or restless nights show up, the damage is already severe. The good news is you don't have to wait until it's too late. In today's video, I'll share 7 science-backed strategies, from a simple vitamin that costs just pennies a day, to daily habits you can start right now that may reduce protein in your urine and protect your kidneys. No detox scams, no miracle cures, just proven facts you can use. And pay close attention, because one of these strategies is a surprising twist that almost no one talks about. It could be the missing link to saving your kidney function. I'm Dr. Mattheus from Kidney Health 365. If you care about protecting your kidneys, hit subscribe and turn on the notification bell so you never miss these life-saving updates. Now, let's dive into the first step you can take today to protect your kidneys. So, what exactly is proteinuria? Simply put, it's the presence of protein in your urine, and it's one of the earliest and most important warning signs that your kidneys are under stress. Your kidneys normally act like high-tech filters. Inside each kidney are about 1 million tiny filtering units called nephrons. Each nephron contains a glomerulus, a delicate cluster of blood vessels designed to hold back essential proteins like albumin, while letting waste and excess fluid pass into the urine. When your kidneys are healthy, virtually no protein escapes into your urine. But when damage occurs, these microscopic filters start to break down. Proteins that should remain in your bloodstream begin leaking through, creating the foamy urine that many people ignore. So what causes this leakage? The biggest culprits are diabetes. High blood sugar acts like liquid sandpaper, scarring the delicate kidney filters. This condition, called diabetic nephropathy, is one of the leading causes of kidney failure worldwide. High blood pressure. Constant pressure forces proteins through membranes that should keep them inside your blood vessels. Autoimmune diseases. Conditions like lupus can make your immune system attack your kidneys directly, creating inflammation and damage. Infections. Some, like strep infections, can trigger immune reactions that mistakenly harm kidney tissue. Medications. Long-term use of common pain relievers, such as ibuprofen, certain chemotherapy drugs, some antibiotics, and even high doses of vitamin C can strain or damage your kidneys. Now, I'd love to hear from you. Have you ever noticed foamy urine, or dealt with diabetes, high blood pressure, or medications that affect the kidneys? Share your experience in the comments. Your story might help someone else watching this video. Understanding what proteinuria is and where it comes from is the first step. But what happens if you ignore it? The consequences reach far beyond your kidneys. Let's move on to the next part, the hidden dangers and complications of untreated proteinuria. When proteins start leaking into your urine, the damage doesn't stop at your kidneys. It sets off a chain reaction that affects your whole body. Here's what happens. Edema, or swelling. As blood protein levels drop, fluid shifts out of your blood vessels and into surrounding tissues. That's when you start noticing swelling in your legs, ankles, hands, and even your face. Over time, this swelling can become severe and uncomfortable. Liver overload. Your body still needs proteins like albumin, so your liver goes into overdrive to replace the loss. This extra workload can strain your liver, disrupt normal protein metabolism, and interfere with processes like wound healing, immune defense, and muscle maintenance. Immune system and muscle impact. With protein balance disrupted, your body struggles to fight infections, repair tissue, and maintain muscle strength. That's one reason why people with advanced kidney disease often feel weak and fatigued. Cardiovascular risk doubles. This may be the most dangerous part. Studies show that even mild proteinuria doubles your risk of heart attack and stroke. The reasons include higher inflammation levels, disturbed blood lipid balance, and the extra strain on your heart and blood vessels as your kidneys fail to keep fluid levels in check. So ignoring foamy urine is never harmless. It's not just a cosmetic issue in the toilet bowl. It's a sign that your whole body could be at risk. The good news is that research has uncovered a surprisingly simple tool that can protect your kidneys and even reverse some of this damage. And it's not a drug, but a nutrient you may already know. Let's move to the next section. Vitamin D, the kidney protector you've probably overlooked. When you think of vitamin D, you probably think about bone health. But here's the surprise. This simple nutrient may be one of the most powerful kidney protectors we have. And unlike expensive treatments, it costs just pennies a day. Researchers have discovered that vitamin D doesn't just help prevent further protein leakage. It can actually calm inflammation, reduce scarring, and in some cases even restore kidney function that doctors once thought was permanently lost. How does it work? At the center of kidney damage is something called the renin-angiotensin-aldosterone system, or RAAS. When this system goes into overdrive, it creates high blood pressure, inflammation, and scarring, the perfect storm for kidney failure. Vitamin D naturally helps suppress this overactivation, lowering renin levels, easing pressure on the kidneys, and slowing the destructive cycle. But that's not all. Vitamin D also reduces inflammation. It lowers harmful cytokines like TNF-alpha and IL-6 while boosting anti-inflammatory pathways, creating a more balanced immune response. Fights fibrosis. It can reduce the activity of scar-forming cells while promoting the breakdown of existing scar tissue. This helps preserve and even repair the kidney's delicate filters. Unlike conventional anti-inflammatory drugs, which can sometimes worsen kidney function, vitamin D offers these protective benefits without the harmful side effects. Now that you see how vitamin D works inside your kidneys, the natural question is, does the science back it up? The answer is a resounding yes. Let's look at the research and real-world studies that prove its power. This isn't theory. Vitamin D's kidney protection is backed by solid science. A landmark study published in the American Journal of Kidney Diseases followed 168 patients with chronic kidney disease for 2 years. Half of them received vitamin D supplementation, while the others received standard care. The results were dramatic. Those in the vitamin D group showed a 42% reduction in proteinuria, compared to just 3% in the control group. Even more striking, the vitamin D group maintained stable kidney function, while the control group continued to decline. Some patients in the vitamin D group even saw actual improvement in kidney function, something doctors once thought impossible. Another groundbreaking trial was published in the Journal of the American Society of Nephrology. This study involved 281 diabetic patients with proteinuria. Those given vitamin D for 48 weeks not only showed a significant drop in proteinuria, but also experienced better blood pressure control, fewer cardiovascular events, and slower progression of kidney disease. What's more, the benefits remained even after accounting for other medications the patients were taking, showing vitamin D's independent protective power. And it doesn't stop there. A meta-analysis published in Kidney International reviewed 26 studies involving over 3,000 patients. Across the board, vitamin D supplementation consistently reduced proteinuria. The greatest benefits were seen in patients who started with the lowest vitamin D levels, and the improvements were most pronounced when blood levels of vitamin D were raised above 30 nanograms per milliliter. Benefits often appeared within 3 to 6 months of supplementation and continued for up to 2 years. What about you? Do you find it surprising that a low-cost vitamin can show results that strong in large-scale studies? Share your opinion in the comments. I'd love to hear your perspective. So now that we've seen the science, the next big question is, if vitamin D is so effective, why are so many people deficient in it? Let's explore why deficiency is so common and what factors make it worse. The challenge is that vitamin D deficiency has become epidemic in today's world. Unlike other vitamins that we mostly get from food, vitamin D is primarily synthesized in your skin when exposed to sunlight. But modern lifestyles, working indoors, wearing sunscreen, aging skin, and even D natural food sources are limited but powerful. Fatty fish are the best option. Wild-caught salmon can provide between 360 and 700 international units per 3.5-ounce serving. Mackerel offers even more, with some varieties giving over 1,000 IU per serving. Sardines supply about 270 international units, plus beneficial omega-3s. Herring, anchovies, and trout are also excellent. Fish liver oils are the most concentrated sources. Just 1 tablespoon of cod liver oil can provide around 1,360 international units, enough to meet or exceed daily needs. But be careful, it's also high in vitamin A, which can become toxic in large amounts. Egg yolks from pasture-raised chickens contain significantly more vitamin D than conventional eggs. Mushrooms exposed to UV light can offer anywhere from 375 IU in portobello mushrooms to over 1,100 IU in Maytake mushrooms. However, these provide vitamin D2, which is less effective than D3 at raising blood levels. Fortified foods also help. Since the 1930s, milk in the US has been fortified with about 120 international units per cup. Many plant-based milks, soy, almond, oat, are fortified similarly. Some orange juice brands provide 100 to 140 international units per cup. Certain breakfast cereals are fortified too, though amounts vary widely. But for most people, food isn't enough. That's where supplementation comes in. Vitamin D3, cholecalciferol, is more effective than D2, ergocalciferol, at raising and maintaining blood levels. Supplements come in capsules, tablets, drops, or gummies. Liquid forms may absorb slightly better, but quality capsules work well for most people. How much do you need? For kidney protection, many specialists recommend starting with 1,000 to 2,000 international units of vitamin D3 daily. Some people with severe deficiency may need 3,000 to 4,000 IU per day to reach optimal levels. Because vitamin D is fat-soluble, taking it with a meal that contains healthy fat improves absorption by 30 to 50%. Some prefer taking it in the morning to avoid any possible sleep issues. Safety matters. While vitamin D is generally safe, too much. So now we know where to get vitamin D and how to use it safely. But what happens when you combine vitamin D with lifestyle changes like diet, exercise, and stress management? That's where the real power shows up. Let's look at a case study that brings all these pieces together. Maria's story shows just how powerful vitamin D can be when combined with a comprehensive approach. After discovering her proteinuria, she didn't just start supplementing, she reshaped her entire lifestyle. Her doctor put her on vitamin D3 at 2,000 IU daily. In just 4 months, her blood level rose from a deficient 18 nanograms per milliliter to an optimal 42 nanograms per milliliter. She also made big dietary changes. By cooking at home and reading labels carefully, Maria cut her sodium intake from more than 3,000 milligrams a day down to under 1,800 milligrams. She added berries to her breakfast, fish twice a week, and switched to olive oil for cooking. She slightly reduced her protein intake, focused on high-quality sources, and spread it evenly throughout the day. Exercise became a cornerstone. Maria added 3 45-minute walks each week to her running routine, giving her steady, moderate activity that supported her blood pressure without overtaxing her kidneys. Stress management was another key. Realizing her high-pressure job contributed to her blood pressure, she committed to 15 minutes of meditation each day and joined a kidney disease support group. The results were remarkable. After 6 months, Maria's proteinuria had dropped by 60%, from 180 milligrams per day to just 72 milligrams per day. Her blood pressure fell from 145/92 to 128/78. Most importantly, her eGFR, a measure of kidney function, improved from 68 to 74 milliliters per minute per 1.73 square meters. Instead of the steady decline her doctors expected, her kidney function actually improved. 2 years later, Maria's kidneys remain stable. Her proteinuria has continued to fall, and she has avoided the slide into advanced kidney disease that once seemed inevitable. Maria's success shows how powerful vitamin D can be when used wisely. But here's the catch: not everyone gets the same results. Why? Because many people unknowingly make mistakes when taking vitamin D that limit its benefits or even cause harm. Before we wrap up, let's take a closer look at the most common pitfalls to avoid when supplementing with vitamin D. Now, before we wrap up, it's important to clear up some of the most common mistakes people make when trying to boost their vitamin D. These slip-ups can keep you from getting the benefits we've talked about, or even put your health at risk. Mistake number 1: taking vitamin D without testing. Many people just start popping supplements without ever checking their blood levels. But vitamin D needs vary a lot from person to person. What works for your neighbor may not be right for you. That's why a simple 25-hydroxy vitamin D blood test is so valuable. It tells you exactly where you stand. Mistake number 2: relying only on food. While foods like salmon, eggs, or fortified milk do contain vitamin D, it's nearly impossible to reach optimal kidney protective levels from diet alone, especially for older adults. Most people need supplementation to get enough. Mistake number 3: choosing the wrong form. Some people still use vitamin D2, which is less effective at raising blood levels. Vitamin D3 is the form your body uses best and the one you should look for in supplements. Mistake number 4: forgetting to take it with fat. Vitamin D is fat-soluble. If you take it on an empty stomach or with black coffee, you're wasting much of the dose. Taking it with a meal that includes healthy fats, like olive oil, avocado, or nuts, improves absorption by up to 50%. Mistake number 5: overdoing it. More isn't always better. Taking too much vitamin D for too long can build up in your body and actually damage your kidneys. That's why staying within safe daily limits and monitoring blood levels with your doctor is essential. So here's a quick question for you. Have you ever made one of these mistakes, maybe without realizing it? Share your experience in the comments. It could help someone else avoid the same problem.
Now that you know how to avoid these pitfalls, you're ready to use vitamin D safely and effectively. Let's bring everything together and talk about the key takeaways and the urgent reasons to start protecting your kidneys today.
We've seen how something as simple as foam in your urine can be an early signal of kidney damage. We've also learned how vitamin D, along with practical lifestyle changes, can reduce protein leakage, calm inflammation, and even help restore kidney function. But here's the urgent truth. Kidney problems often progress silently. By the time you feel swelling in your ankles, constant fatigue, or trouble sleeping, your kidneys may already be severely damaged. That's why starting today matters. Every small step you take now can make a real difference in protecting your health tomorrow. And here's the inspiring part. Maria's story shows it's possible. With vitamin D, a few diet changes, and a focus on stress and exercise, she turned her health around. If she can do it, so can you. So here's what you can do next. Talk to your doctor about checking your vitamin D level. If you're low, consider supplementing under medical guidance. And start with just one small habit today. Maybe a daily walk, maybe swapping soda for water, or adding a serving of berries to your breakfast. Remember, this video is for education only. It's not a replacement for professional medical advice. Always work with your healthcare provider before making major changes to your diet, supplements, or treatment plan. If you found this video helpful, please subscribe to Kidney Health 365 and turn on notifications so you never miss new updates. And don't stop here. The next video on your screen reveals 22 foods that can quietly harm your kidneys and what to do instead. Watch it now to stay informed and stay healthy.